my name is Dr. Erin Denil with Rejuvenate Life Chiropractic, and today I would like to discuss a common condition in which we have elbow complaints. So couple things to remember about our forearm as well as our elbow and into our wrist. If we have an area that is stuck or not moving the way it's supposed to, our brain doesn't take in proper information. We have receptors in these joints that are designed to take on movement. When we don't have that movement, our brain doesn't get the right message, and then our brain cannot send the right message back to our body. So we create chronic conditions. If these things are left without being corrected, they just progress. They become devastating. They can be more debilitating and cause lots of problems down the road. So my first method of treatment is always to go into the wellness chiropractor and get an adjustment first, so we get everything moving, proper information to the brain, get rid of any nervous system disturbances in the whole kinetic chain. So that would be anything from the neck, the shoulder, the elbow, and the wrist. Second is to work on those muscles. Our bones, we have two bones, okay, the radius and the ulna. The thumb side is the radius, the pinky side is the ulna. When we are in anatomical position, these two bones are parallel to each other. When we go in rotating motions, they cross over one another, and it does so by having that thumb side, the radius, it's radical, to twist. A lot of times we'll have a motion that's not allowing us to twist. We will then get chronic tight muscles. If we have the muscles that are chronically tight and they are what we call the extensors, meaning they do this motion, classically called tennis elbow, where we'll get pain on that side. Inside, or the medial side, is where we'll get golfer's elbow, and that's when we have tight flexors. Okay, so different motion will give us different irritations. So with the elbow, depending on how it was injured, it's going to be important to work on the musculature as well. So one of the things that I like, there's it can be called a trigger wheel, like if you buy it on Amazon, or you can get a garage door wheel. It'll look similar to this. This is a little different. This is just my reflex hammer, but it will actually spin and you can work out the muscles. You can use a tennis ball or a baseball and go up against the wall and hold for 30 to 45 seconds on those muscles. You can do what we call a cross-frictional massage, and for about 2 minutes, just sit here and perpendicular to those tendons, so tendons would run up and down, perpendicular to those tendons or those muscle bellies, you can rub it. Okay, other things for stretching. One of the best exercises for anything that's a carpal tunnel-like exercise, and I have this one as a video as well, is just the hands out and the arms out in a T and the hands, fingers up. You can also do this with the fingers pointing down to get a good stretch. Okay, so up and down, and again holding for that 30 to 45 seconds while you do it. Another exercise that you can do, be very careful of the wrist. You can support the wrist and just stretch. So you'd be stretching, going down, and then prayer position stretches this way. We can take the fingers, gently pull them back to your comfort zone. Now I'm pretty flexible. This is not problematic for me either direction. Okay, but a lot of people will only get just a slight bit of motion backwards or forwards before they will feel the stretch. So the Gumby like Dr. Erin, okay, versus just the average person. So from the front, you're just getting a good stretch in there. So again, holding those stretches for about 30 to 45 seconds. So to review, best thing, make sure that joint is moving with your wellness chiropractor. Second thing, cross-frictional massage across those tendons. Massage therapists or chiropractors who do more muscle work might also work and stripping the muscle, going up towards the heart. Then making sure we support with stretches, T-shaped position, shoulders down, fingers up, and some people might be here and get plenty of stretch, and down. Again, holding each of these for 30 to 45 seconds. Could also look like holding this way for 30 to 45 seconds and holding this way for 30 to 45 seconds. Some people will do it more in this position and this position. however is comfortable for you. Some people will even go down. Let me see if I can show you. So they'll put their hands on a surface, okay, like a corner of a table or a chair, and they will lean forward and they can get a good stretch as well. So the elbow has two very common conditions, and it depends on where you have injured yourself over time. If it is on what we call the lateral or the thumb side, then it is considered a tennis elbow. If it's on the medial side, it's considered a golfer's elbow. Usually we'll have both. Best thing, also that tennis ball, I talked about that. Do things both sides. Most of the time we've injured ourselves on one side, but it's good to give a little balance. I don't just put one arm out and do this, right? I'm gonna do both as long as I'm in this position. So hopefully this helps with any of your wrist, elbow complaints that you're having for things you can do at home. Consistency is key. I recommend doing this daily, twice a day for at least the first 2 weeks, and then you can go less from there. But if we don't have that joint moving properly, we're not going to have good nerve signaling. If we don't have good nerve signaling, then we're not going to have what we're looking for. So the combination. But this is definitely something supportive to make the condition heal faster. And again, a trigger wheel on Amazon or like a garage door wheel works great for those people who just like to give a good rub to that specific area it's hard to reach. Dr. Erin Denil with Rejuvenate Life Chiropractic, and I hope you have a fabulous day.